This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Welcome, everybody, live here on AchieveRadio.com. I'm Ginny Sanders, also known as Ginny Almighty, and I'm your host this evening along with Dr. Carolyn Dean for Live with Dr. Carolyn Dean, the 2-hour health radio program that is actually guaranteed to transform your health. Oh, yeah, a lot of people will talk about it, but not a lot of people actually know much about it. But fortunately for us, Dr. Carolyn Dean knows everything about it. And I'm not exaggerating. You know, she just knows about everything there is to know about your health. And you know why she knows that? Because she knows at a cellular level, biologically, what is required. She knows at an emotional level, biologically what's required. She knows at a mental level what is required for health, vitality, and well-being. She knows at a structural level what is required, and she provides it all to you in the form of her health wisdom, her information, all of her formulas, homeopathy. I mean, she can talk about everything, ladies and gentlemen. Herbs, she can talk about acupuncture. She's done it all. She's seen it all. She's watched the trends. She's seen the fads. But she knows one thing. The design of the human body hasn't changed much in the last couple thousand years. It's still right on track to do and be what it's always done and been. And that is to be extraordinarily perfect and require a handful of things as building blocks to provide health for you. That's what we're going to talk about for the next 2 hours. And you're just going to enjoy it so much because you're going to hear things you've never heard. You're going to be inspired in a way that you've never been inspired to know and to trust that your body is amazingly perfect. It will heal itself. It will perform its functions impeccably as long as you just give it the basics and a little TLC. So wrap your arms around yourself. Give yourself a quick squeeze. Hug yourself today and honor and love and appreciate that body and that mind and that heart, that spirit. And let us celebrate together the triumphant entry of one of my dear, dear friends and the bestest doctor in the whole wide world, Dr. Carolyn Dean.
Ginny, once again, you've outdone yourself. I appreciate the kudos, and you've inspired me with something you said around the topic of the human body is amazingly perfect. So what I realized in the blink of an eye was perhaps that's modern medicine's intent of telling us to be afraid, to be very, very afraid, to funnel us into modern medicine clinics, the HMO system, always get our blood tested, get our mammograms, get our x-rays, get everything done unto us so that we can be given drugs which will keep the whole modern medical system going. And that's exactly what we're going to talk about today. As it turns out, Ginny's blog, our Monday blog that she put out today was about testing. The saying, to err is human, to forgive is divine. I bastardized that in the Magnesium Miracle book, actually, and said, to err is human, to test is divine. And this is what medicine is doing, quantifying, quantitating, numbering, trying to put us all in a little box. Jenny's got some good words there. You can see that blog at drcarolyndeanlive.com. But my general comments are that all tests have to be compared with the so-called average. And in order for a test to have any meaning, I mean, we're talking about any test, blood tests, urine tests. So what people are mistaken in looking at lab tests, I don't even know if doctors really understand this themselves, that what you're compared with is the average sick individual who walks into the same lab, has the same test, they take those numbers, and they put your result in the middle of those numbers. And average is not optimal. It's not even normal. Average is just the average of the sick population in our midst. So in every case, with the odds being that the general population is ill, on meds, undernourished, then there's no possibility of that being normal and anything to aspire to. And as you know, I've said this over and over again about the magnesium tests, along with the fact that they don't use the optimum test, which is the ionized magnesium test. They're using a serum magnesium test, which is measuring only 1% of the body's magnesium in the serum. So we don't even know with all the tests that are being done if they're the best test. Just to kind of finish up on magnesium and to go back to Ginny's blog, she talks about the way we look at magnesium in our customer service, etc. Is I tell people to look at your clinical picture and make that your guideline for taking your ReMag. And what I have said to people, of course you all know, is to get a magnesium RBC test, not because it's the best test, but because it's just a little better than the serum magnesium, and it's something that you can follow. But even that is not the most accurate test. So what we're looking at then is, let me just get to my notes. Just more general comments. Even with alternative medicine testing, what's happened with alt-med testing is it's a moneymaker for doctors. I worked with alternative medicine doctors in New York when I was doing the AIDS and chronic fatigue work, and we worked in some of these doctors' clinics. And one of them admitted to me that with her overhead being 80%, in renting in Manhattan, having to have a lot of people on the phones for all the questions that arise in alternative medicine, her overhead was 80%, so that meant she had to sell a lot of supplements and sell a lot of testing. Most doctors, I mean, they'll tell you if they're not surcharging you on testing. You know, they'll be happy to tell you, look, you're just paying what I pay the lab. If they don't say that, then you're pretty assured that they're double billing you. That's not the word. For example, if a test costs you $200, usually the lab is charging $100 and the doctor is taking the other $100. That's how they're surviving, is by selling tests and selling supplements. So you're going to get a lot of tests when you go to alt-med doctors, unfortunately. Hair analyses are big in alt-med, and I've said this before, I'm sure. A few years ago, I had it done by a person who was launching himself into the magnesium world, and I wanted to assess his skills to perhaps use him as a referral. However, there were so many discrepancies with my results, I realized it was probably because I was fully saturated with magnesium and my other minerals that it put all the so-called normal ratios with all the other minerals out of whack and totally interfered with the interpretation of my test. So it's hair analysis, it's 3 months on, when you clip hair from your head, it's grown out for 3 months from where it took up minerals from the roots. So how is that accurate in terms of what's going on with you right now? So many variables with that test. And I realized right there that I just wanted people to take their sea salted water, take lots of ReMag, take their daily Remite to slowly balance their body's minerals. Otherwise, you have people with low minerals being told to ingest lots of dirt minerals that are not properly absorbed. For example, with low calcium in the hair, they may be told to take a type of calcium that's only 4% absorbed, which is the case with most calciums, and it'll build up in soft tissue. So with the magnesium, I mentioned that, and then we look at the pros and cons of blood testing for cholesterol. So this is under the heading of misuse tests. Cholesterol tests are mainly being used to determine whether or not people are given statin drugs. And what I've mentioned many times is when I went to med school, the so-called average cholesterol was mid-200s. And that was before statins. And now I noticed at the Cleveland Clinic, their cholesterol range is 100 to 199 for adults over 21. And to me, it's a horrifyingly low level of cholesterol to aspire to. It's low enough to cause brain damage because there's not enough cholesterol to ensure the brain cells are coated with the lipid membranes that they require. It's not enough cholesterol to make hormones if you're at 100 or 150. I just don't know what these people are thinking. So the other aspect of cholesterol, though, obviously, is that cholesterol as a cause of heart disease is a myth. It's being rejected more and more. Read the book by Dr. Malcolm Kendrick, The Great Cholesterol Con, just to really reinforce how medicine has been promoting cholesterol as the cause of heart disease. And even though all the studies using statins that aren't done by the industry shows that it's not extending a person's life. Maybe it will batter down your cholesterol levels, but that doesn't end up helping you. And now what's happened is the modern medicine is promoting these fractionated cholesterol tests to further dupe the public. I mean, people are getting away from cholesterol as being the cause, so okay, let's do different blood tests, and we'll let that run for a few decades before people catch on. So you're going to be getting tests like lipoprotein A, so it's a LDL test, low-density lipoprotein, attached to a protein called APO. But like LDL, it's, as I was saying before, LDL cholesterol is not the problem. But they're saying, oh, yes, you can't have high lipoprotein A. It's bad for you. The other one, apolipoprotein A, that's the major protein of HDL. So they're just dragging the HDL and LDL back into the fray with new names and the same results. They just want you to take the statin drugs so you beat these things down. But one thing they are saying about this lipoprotein A, is it measures an enzyme associated with inflammation, stroke, and heart attacks. And what blocks this enzyme that's associated with the inflammation, stroke, and heart attack? Magnesium, of course. So they'll never come to the right treatment of these cholesterols. They'll just keep giving statin drugs. So blood testing, I mean, there's a lot more to talk about, but again, when you're looking at the blood test, just remember the experience that I've been telling you about with magnesium. They don't know how to test magnesium properly, so when they do, for example, your electrolytes, and they don't even put magnesium in the panel, you know they're not getting an accurate assessment of your electrical conductivity in your heart and your brain. Saliva testing, that's being done now for hormones. And in saliva testing, when I started seeing it being done on hormones, about 20 years ago, I even wondered back then what and who determines the norms and the optimums. So when someone is given hormones, the levels are just almost impossible to assess. Because the mucus that you use in the saliva testing can be saturated with these synthetic exogenous hormones. I don't know if I want to say a lot more about that. I know in blood and saliva testing for hormones, Jonathan Wright got into testing all the downstream chemicals of hormones, just to, again, drilling down further and further and deeper to find the answer. And it was literally impossible for the average doctor to analyze. I tried all these tests on my patients over the years, and I'd call up and ask for one of the consultants to run me through the testing, and it was all just kind of hearsay. And if you go back and just look at the clinical picture of a person, and as I've said many, many times, let's balance the minerals, let's get rid of the yeast overgrowth, and then we'll have a level playing field to do some testing instead of doing the $1 million workup when a person walks in a clinic and there's all kinds of things interfering with the results. Get a level playing field. And as we see all the time in our customer service, are people who are on the building blocks, the completement formulas, they do so much better. They, most of them, the vast majority, don't seem to need further testing. Stool analysis, the alt med lab started doing them for yeast and to determine the probiotics. But what I learned in my training was when you do a stool test for yeast, you're often getting the yeast that are just sloughing off. You're not getting the yeast that are embedded, the yeast that are in there, and they're not going to drop off. I know that sounds kind of too much like a generalization, but it struck home for me because we weren't doing internal biopsies. We weren't doing biopsies, in a colonoscope or doing upper GI biopsies or samples, I should say, of the intestinal or the upper gut contents. And the same for probiotics. They just were studying probiotics in the stool, and that's where they came up with lactobacillus and bifido bacteria as the main probiotics. But when they finally started doing sampling of the intestinal contents, that's in the world of probiotics, they began to see the soil-based bacteria as the most important one. So again, doing all this testing, you'll read books of probiotics that just go on and on and on about lacto and bifido. And yeah, it's great. They say, well, this bacteria is associated with obesity or not, and we'll manipulate the bacteria, and then maybe we'll be able to help people. But again, it's all speculation. There's not a lot of common sense behind it. Genetic testing, I've railed on about that quite a bit. It's funny, a couple weeks ago I said, well, maybe I should get the 23andMe and check myself out. Why not? So I actually ordered kits for me and Bob. I didn't even tell Bob. But then I started looking even further than I had before. Well, what are they going to do with this DNA? And it turns out there are a lot of privacy issues with genetic testing. You sign a release that means the company owns your DNA, and there's
no way.
Yes. If
Are you so really, all these people are donating their DNA and they don't even know it?
Yeah. They own your
wow.
DNA. If you've got really cute DNA, they want to own that. If you've got a type of DNA and that's what they're kind of banking on. If you've got a type of DNA that heals cancer, then they own you and your DNA. And what they're doing outright, and they kind of brag about this, I think I've blogged about this, at least in my head I have, that they sell your DNA to drug companies so that drug companies can test your DNA against drugs to see whether or not this particular drug is good for your DNA or not. I mean, just Google it. You will see.
That's disgusting.
I know. Here it is.
Wow.
They can and frequently do sell your data to drug makers. It will also use the genetic data to inform how patients are selected for clinical trials. So certain people with gene SNPs that do or don't allow metabolism of a certain drug, they'll say, oh, well, you will probably be okay with this drug, and oh, you have this genetic disease condition. Why don't you join our clinical trial where we know this drug will work for your disease? So, yeah, they're manipulating the whole thing totally toward drug intervention. And, people doing genetic testing, what they're being told is a complete lie in a sense. They're being given the information that, well, you can know your DNA and know what diseases that you may be susceptible to so you can prevent them. But they don't give you any prevention because, they don't know any prevention. They just know drugs. So, yeah, it's pretty scammy. And that's a vast generalization, of course. People will probably be on the chat or emailing us, well, the testing really helped me. And, yes, it could be helping a certain percentage, but not in every case without fail or exception. And I don't want to have my DNA stolen, so I returned them. Then there's the X-rays and CAT scans. Well, that's radiation, and it's like we've just forgotten that all these scans are ionizing radiation, which is cumulative, and is just adding to the insult on our body. Then there's mammograms where your breasts are squished to the point of, some people are concerned that an encapsulated cancer will be squished out of its capsule and start spreading. And I don't plan here to scare people, but you really should know that there are studies that show that women who get regular mammograms are actually more susceptible to breast cancer. And what I'd love to see is people getting thermography. Thermograms measure the tiny little minuscule degree of temperature increase where you can know if cells in your breast are metabolizing rapidly, which indicates some sort of tumor or cancer, and you can either know that like 5 years before you're forming your lump that your doctor finds, and do all kinds of natural things that detox your body, to take more magnesium if it's one of these DCIS, disseminating intraductal carcinoma, which is just calcifications for the most part. So thermograms, look into thermograms in your geographical area and go for those instead of mammograms. MRIs, magnetic resonance to image the body. I don't know if there's a lot of negative about MRIs, except on your brain. Some people have told me that it really seems to irritate their brain, and I don't know much more than that about them. But with the MRIs and CAT scans, they're looking for problems. A lot of people have various abnormalities in their body, a little speck here, a lump there, something on the pancreas or liver or spleen or lungs. And when a doctor does these tests, these X-ray and MRI tests, and they find something, they just want to go in there all gung-ho and take it out or look into it. And you can read some of these books about overdiagnosis, overtesting. Just Google it on Amazon, and it's incredible reading the actual studies showing that when people are scanned for certain diseases, how many people is it really saving and how many people is it harming, because the tests themselves have side effects or lead to misdiagnosis, lead to overtreatment, and lead to a lot of side effects down the road. EKGs, electrocardiograms. I don't know how electrocardiograms can have a normal when so many people are so low on magnesium, and no one's done a study of the ionized magnesium test compared to certain EKG tracings. I mean, would be a huge endeavor to undertake, but certainly EKGs are important to know if you have an arrhythmia, but then when the treatment is just medication instead of minerals, especially magnesium, then it's once again doing a test to lead you down a drug path. EEGs, electroencephalograms, I don't know a whole lot about. I don't know if it's similar to EKGs where the brain really needs the magnesium to make your encephalogram reading come into a normal balance. I mean, there's a lot more that I could say. I think that's enough of an overview. If we have chat questions, that would be great. I guess my final comment is just you got to trust yourself. What's amazing about women is we do know our bodies. We know things. We are intuitive. It's not something that you should ignore or brush aside. But what we do when we go into a doctor is we stop trusting ourselves, and we start trusting the doctor who has no knowledge of you and your history or who you are. As we know, it's a 5 or 7 minute appointment, and they will tell you things that don't feel right, don't sound right, are not common sense, and they expect you to believe it. And I'm not saying to people to go in there and start fighting with your doctors. That's not the point. The point is to get their information and then put it in your own thinking process and see whether or not it makes sense. Instead of just saying, well, I guess the doctor knows better than me. And really, that is no longer the case. I don't know if the blog is out yet, but what's happened in HMOs is that they have practice management guidelines for doctors now, because there's like 50,000 drugs out there. Doctors don't have a clue what to do anymore when it comes to giving treatment to people. So they depend on practice guidelines. It's all on the internet. They're taking courses that just tell them how to take drugs. I didn't have to read anything outside of after medical school. I didn't read any of the journals or anything. I was just doing my naturopathic training for the most part. But now doctors are, their hands are held, they're given recipes for whatever comes up, and that's what they follow. It's like there's no room for common sense anymore. It's just, here's the recipe, here's the drugs you give, bring in the next patient. So.
Hey, Carolyn, so this overview you gave of testing, do you know anybody else who says what you say about these tests?
I don't think so. I think most of the alt-med doctors, they're gung-ho on testing. They're doing stool analysis and what are they doing, Ginny? All the hormone tests, amino acid panels, neurotransmitter panels. There's a lab that I put a few people through to see what they were doing, and it was just like so arbitrary getting these results. It's like, well, what did you eat yesterday? Well, that's going to show up. But anyway, no, I think to test is divine is definitely something in the minds of most doctors. They want to measure, they want to prove something, they want to do a test to put in front of a patient and say, see, this is bad, so you have to take either this drug or this handful of supplements. They use it as a way of breaking through the barriers to their patients who they think aren't bright enough to do a lifestyle change. They need to be coerced into it. But we're not in that realm. We are attracting customers, not patients. We're not a medical practice. We're attracting customers who want to be healthy, who want to get healthy and stay healthy, and they're just following the common sense that I'm laying out to them. And I'm saying that testing is really not all it's chalked up to be. I haven't mentioned colonoscopies. I do think that is a good test to get, because if you have polyps and adenomas and whatever in your large intestine, they can actually take those out, and that can be beneficial to a person. But for the most part, testing is overdone, and people depend on their doctors to read the test, so it's out of their realm. So they're beholden to the doctors.
So you don't get any too much criticism from this unique view you have?
Well, I don't put myself out there. I would get criticism if I was on, like I was on that ESPN panel where I get criticized for saying that children should be in an Epsom salt bath. Someone wanted to know what's the references, what's the scientific support of Epsom salts, or, children, they could drink the bath water and get diarrhea. They don't want to hear this. I keep myself hiding away here in a little island that I won't even mention, and I don't get involved with doctors because they want to keep the status quo, and I'm rocking the boat. I mean, look what happened to me just by saying, quote, bad things about sugar. They came after my ass, and they will do that to any doctor who's not on board.
Well, that was just me. I just set that up to sort of humiliate you, make you humble before we went to America. That was
Bob. You have overstayed your welcome. Mute yourself.
I bring in
back
humor.
To Ginny. No, Bob.
Does humor belong in medicine?
There you go. All right, we've got some questions here, Carolyn. Hi, Dr. Dean. I'm 63. I've had mammograms every year for years. If I might ask, do you not have mammograms? I will also look into thermography. Thank you. I was going to schedule a mammogram this week.
I have never had a mammogram. I just have thermograms every 5 years. I try to get one, and that's it.
Yeah.
That's it.
Right. Me too. I think the last one I did was in 1984. Don't do them. Not good.
Bob,
okay, Mary.
Neither has Bob.
Very good, Bob. Okay, Mary Ann typing in. Recently, I had a urine test called a metabolic profile, and now the naturopath, ND, has me on ALA, glycine, NAC, carnitine, CoQ10. I've been diagnosed with, yeah, I know, right? I've been diagnosed with PD. I don't know what PD is. Do you know, Carolyn? I've been diagnosed with PD.
No, and people get right into the acronyms. There's so many of them. Tell her to chat in.
Yeah, what's PD, Mary Ann? I've been on the ReMag and ReMite for over a year. All these supplements seem like a lot, and I was given no time frame as to how long I would need to be on these. I wonder if the Realign would help with all the metabolic balancing instead of all these supplements. Yeah, Mary Ann, type in and let us know.
It's Parkinson's disease, hon. That makes sense.
Oh,
and what's interesting, I mean, I'm sorry, we're not, making fun of you because you're on all these supplements. I kind of laughed because the ALA, the cysteine, the whole list that Ginny read out, they're the standard antioxidants that everybody is given. So you probably paid a few $100s for the metabolic profile. They just put you on the standard antioxidants. And my whole concern about antioxidants is that a lot of the metabolism in the body is oxidation. So if someone is doing antioxidants, are they interfering with oxidation? And I've never used the ALA and acetylcysteine and carnitine and all those. I've never had to because people seem to do well enough on the protocol. And in terms of the protocol, personally, if I had Parkinson's disease, I would definitely be on the Realign at least 2 a day. I'd be doing my ReMag and ReMite in substantial doses, like 3 and 4 teaspoons of ReMag, 2 teaspoons of ReMite. I'd be doing the RNA drops to get my perfected cells. I'd do the yeast questionnaire, make sure that I didn't have yeast toxins. I'd look at the whole protocol that we have for total body meltdown. And then I wonder, I'm looking up right this minute in Total Biology if I have some entries on Parkinson's. Yeah. And Parkinson's is about unblocking a function. There is a conflict in Parkinson's. This is where you would work with our friend Dr. David Holt, who does telephone consultations. So I'll just read you this little story. A lot of our teaching came in stories. And I haven't read it in a while, so I'll just stumble through this. A gentleman with Parkinson's, for years he wanted to do something. When he was 6 years old, his mother punished him. One day he had enough, and he pulled back his hand. She warned him, "If you hide your hand again, I'm going to beat you even more." He always wanted to remove his hand, but he wasn't able to. This creates an important tension in the brain. Later, at age 18, he desired a girlfriend. They walked together. He loved her and he wanted to touch her hair, but he never allowed himself to touch her hair in 5 years. This was his conflict, wanting to do something but never being able to do it. So what it does, it sets up this tension of like a push-pull tension in your hand. You can imagine you're trying to reach out and you're pulling yourself back. So, and that's sort of how Parkinson's comes across. Anyway, this is how I see a person with a chronic illness is let's give the building blocks, let's do it, in a balanced way, treat the yeast, and also if it's a big conflict, like with something like Parkinson's, do total biology.
Good. Excellent. Thank you, Carolyn. That was great. Thank you. Thank you very much. Okay, let's see. Dr. Princetta typed in, Carolyn, we love Dr. P. Hello, Dr. P. He's one of our favorites. He's so good. Dr. Princetta, he says, I order tests sometimes, but not always. And the reason I do is to rule things in as opposed to ruling things out. An example would be magnesium RBC. If it's low, I will use the ReMag, wait 3 to 4 months, and then I retest to show the patient improvement. I do understand what you're discussing here. People are tested incessantly trying to find out what's wrong instead of what's right.
Oh, that's perfect. Yeah, brilliant. Yeah, good point. And that's what the reputation I developed in Toronto with the specialists and the labs is that, well, if Dr. Dean is ordering something, she must know it's there, and she's just confirming. Otherwise, yeah, it's like searching for a needle in a haystack, and the tension and the conflict of someone where they keep searching for the reason behind something wrong. I mean, just recently someone here in the complex said that her a relative had a spot on her brain, and I immediately, a small little, abnormality, I immediately thought of total biology and German new medicine, where Dr. Hammer, in his brain scans of people with major conflicts, they would find a focus in the brain. It was an actual, what most radiologists would call an artifact. And this artifact is related to the conflict, and when the conflict is resolved, when the body area heals up, then the artifact goes away in the brain. So they, not knowing what the body and the brain are doing, will see, radiologists will see these artifacts. I mean, this person actually had a brain biopsy to try to figure out what this was. The ability we have now to invade the whole body from head to toe is it's just impossible to pull back. And because, once you open that Pandora's box, well, you have something in your brain, then you want to find out what it is. Otherwise, you're sitting there with a conflict and potentially causing yourself more harm. Over to you, Jenny.
Very good. Okay, let's see. Lana typed in this. What do you think of CAC, which is coronary artery calcium? What do you think of CAC testing? Would the ReMag dissolve the buildup if it showed up? There is a keto guy who was really pushing this CAC testing.
Well, the coronary artery calcium test will show if you've got calcium in your arteries. Apparently, what I just read, I was looking into it for something else. It's like a $200 test. I don't know if all insurance covers it. Doctors really aren't using it a lot. They tried to use it for creating the, a total risk factor analysis for heart disease, but there's no treatment for it, so they're kind of pulling away from it. But what we know about ReMag is that if you saturate yourself with ReMag, you can potentially be dissolving calcium in soft tissues and arteries and direct your calcium into your bones and teeth instead of letting it deposit in soft tissues. And we know this from people who've gotten before and after scans, and we have this one lady who had a carotid artery calcification, which diminished greatly using the ReMag. But we're not in a position to do those studies. But we know physiologically that saturating with magnesium, and seriously, the only magnesium you can saturate with without getting an immediate laxative effect is ReMag. So I know with people who've had bladder calcifications, which cause them to be on adult diapers, that diminishes. We know people who've had heel spurs, arthritic calcifications in their fingers. We're seeing this quite a lot, and we're not saying that it'll happen for everybody, but the coronary artery calcification score was another way to risk analyze heart disease and to give more statins. But people then, doctors said, well, what are statins going to do for calcium? And because they have no drug for it, they're pulling back from that test. I don't like it. Well, I guess I would like it if people took the test and then did the ReMag and took the test and showed that it improved. But, see, they're looking at the coronary artery. How this came about, I believe, is when they were doing mammograms, they started seeing the outline of calcium in the coronary arteries. And then they just spun off the mammograms into this coronary artery calcification. But and they can see carotid artery calcification, but they're forgetting about kidney artery calcification, which is happening just like the other arteries. And instead of looking at calcification as an imbalance or a lack of magnesium, they're just measuring it. They just continue to do their measures without proper treatment for calcification.
And that's exactly what Dr. P said, Carolyn. He said doctors do not utilize the coronary calcium test because they have no answer to cure it. They do not know about ReMag and ReMite. I have used these products and watched the calcium score diminish by hundreds of points.
Woohoo! Oh, awesome. Woo-hoo. There we go. There's our clinical trial. Thank you, Dr. P. Appreciate that.
Very nice.
Oh.
Okay. Here's Joanne typing in from Florida. And we've been so busy on the chat line and chitty-chatting back and forth. I forgot to tell everybody we are going to take phone calls this evening, you guys. I'm so sorry. 602-666-6027 is the number to call if you want to talk to Dr. Dean. And we'll probably do it next hour, but *5 on your keypad. If you're here and you have a question, maybe we can get you in before the top of the hour, but you've got to hit *5 on your keypad so I can get you in there. Okay, this is what Joanne says down in Florida. I have hypothyroidism, and I'm taking 50 micrograms of Thyroid and also taking 600 milligrams of kelp, which include 360 micrograms of iodine and sodium, 35 milligrams. I also have a YOS, yeast overgrowth syndrome, based on the yeast questionnaire. My current TSH is 6.12, and my doctor wants to increase my dose. These thyroid tests seem to be all over the place, but doctors will simply test the TSH without testing all the other factors. Is yeast overgrowth syndrome associated with low thyroid?
Okay, now did you say hypothyroid at the beginning?
Yeah, she did say hypo.
Okay, good. No. Yeah, I heard hyper. Now, did she say 360 micrograms of iodine? Okay, well, yeast overgrowth, the toxins from yeast, or just the metabolites from yeast, which we look upon as toxins, they will cross-react with thyroid tissue and block thyroid hormone receptors. So definitely there's an association there. So it is important to do a yeast protocol. And there is a thyroid book at drcarolyndeanlive.com. What is it? Reset the Thyroid or something like that, or Total Body Reset for your Thyroid. And the thyroid-stimulating hormone. Well, actually, Joanne, the way I look at the TSH, that's a good indication of your thyroid-stimulating hormone from your hypothalamus-pituitary area in the brain. It's pushing on your thyroid to make more thyroid hormones. And it implies that the synthroid isn't enough or the iodine isn't enough. And what I learned when I started my own ReMag in the testing stage is, and you've probably heard me say this a million times, that I found after about 6 or 8 weeks on the ReMag, which has 12 minerals, 9 of which support thyroid hormone production. So after 6 or 8 weeks, my temperature rose, my hands and feet were warmer, I started to get a little more activated, and I realized that I no longer needed my 60 milligrams of Armour thyroid. So the TSH will follow that function. And the thing about, it'd be interesting to see if Dr. Princetta, does he do the whole thyroid panel? What is important is to do the thyroid antibodies to see if you have that Hashimoto's thyroiditis where your body is attacking your thyroid tissue, which again can simply be the yeast toxins attacking the thyroid and producing these antibodies. And the problem with just doing iodine and synthroid is that you're not getting the selenium and the zinc and the magnesium. Well, if you're taking ReMag, you're getting your magnesium, but just by pushing the iodine, you're forcing the first step of thyroid hormone production, but then the next step needs selenium. And that's a vast generalization. I'm just trying to, kind of make it flow, but just using one of the 9 minerals that the thyroid needs is really not going to give you proper thyroid hormone function. So read the book, read the 2 books, the yeast book and the thyroid book, and you'll see what we're talking about, and then you can ask more questions. Thank you, Joanne.
Excellent. Okay. All right, so we've got some callers here. Let me see if we can we've got 4 minutes to the top of the hour. Let's try to get in a call, and if not, we'll carry over. Let's go to area code 321, great state of Florida. You're on the line with Dr. Dean. Can you give us your name and then state your question or comment?
Hi, my name is Lori Moretto. And
hi, Lori.
My question, hello. I was curious that you recommended the colonoscopy only because the amount of pressure that goes through the colon, you don't think that there's an issue with that?
I don't. If you're talking about the colonoscopy where they put air in and do an X-ray of the colon, I'm not in favor of that one. I just like just the flexible colonoscopy probe that goes in. I know they have to put a little bit of air in, but I perhaps don't know enough about it to give a good response. I haven't heard that being a problem. What do you know?
Yeah, a friend of mine who was a nurse, she worked in the office, and she just thought that the amount of pressure, and she was a colonics technician, so she knows about water going into the colon. She just thought it was just way, way too much, and so I have not wanted to do that, plus the chemicals that they used so that your colon can be evacuated. So I was just kind of concerned, and I really appreciate and respect your opinion, and I just wanted to kind of go over that with you.
Right. Yes, it may be just where she's, the person that she's working with. I'm looking up and seeing a couple of air pressure-induced colon injury, but that's back in the 1980s. You know, I can't imagine that they're doing that because you see, if you distend the colon too much, you'll obscure normal findings. I don't know if Dr. Princetta can comment, but you would find someone who doesn't blow up the intestines. And as for the bowel prep, you don't have to do whatever the chemicals are. You can still use the mag citrate, and I think, I forget if the only one I've done, I'm pretty sure I did enemas as well to clean myself out.
Yeah.
You know, so mag citrate, I don't know why they moved from mag citrate. It could be that because people are so deficient in magnesium that they were having other effects with taking a magnesium product for bowel prep. So you can get around it, but, you know, especially if there's a family history, I think it's important to get a colonoscopy every 5 years.
Okay, let me just put this on a break. Lori, hang on, because we've got some feedback for you from Dr. Princetta, too. And we're going to take a quick break. Top of the hour, we'll be right back.
Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
AchieveRadio.com. Here we go now. Go to the Carolyn. Here we go now. Here we go now. The wellness scene with Dr. D.
Welcome back, everybody. Hour 2, live with Dr. Carolyn Dean this Monday evening, December 2018. For those who are tripping through the archives, just a little mile marker on the linear time scale here. Want to reintroduce our caller from the first hour, Lori, and also Dr. Dean. And Carolyn, I just want to give the information that was typed in on the previous hour into the chat line, one of which Dr. Princetta said, CEBT scan of the colon detects cancer years before a colonoscopy can. Relatively safe, minimum radiation. I don't know what a CEBT scan is. And then Wendy, so Dr. P, what's a CEBT scan? And then Wendy says, I'm a national board certified colon hydrotherapist. Colonics cannot pierce the colon wall, but colonoscopy implements can. The implements that they use to do the colonoscopy, according to Dr. McCullough, are not clean. They are used with multiple patients, and the type of cleaner that they are using is not sufficient to kill all the bacteria.
Exactly.
Colonoscopies are not preventative. They just find what's already there.
Right.
So those
yeah,
are
they're not preventative. Right. Yeah, I guess what you do with that sort of testing is you find a clinic that does thousands of them and does not have a record of infections or problems. Yeah, you just have to be really careful where you get testing done. And yeah, there are definitely side effects, but it's the one test that I think is can be very beneficial if done by the right person.
Okay, well, thank you very much. And the PST test for prostate, do you feel is pretty accurate?
Well, that's another test that it's fallen into disrepute. So I'm kind of on the fence about that now because I've read good thing, not even good things, but I've read that it's been so overused, and as we're saying with other tests, people then have to go through biopsies and then the side effects of those, and people get scared and then have prostate surgery. So it's a tricky test. I don't have an opinion, actually.
Because my friend in January it was 1.5, in April 3.8, October 5, and then it was 5, and then in December it was 6.3. I mean, wow, that's a big jump.
Well, if there's prostatitis, if there's any sort of inflammation or infection, that's what you look at first. And most prostatitis is related to yeast overgrowth. So I would be definitely doing yeast treatment and then retesting to see if that shifted things.
Oh, okay. I'll tell him. That's great to know. So, great. Thank you so much. That's very helpful.
Okay. Thanks for calling in. Good questions. Appreciate it.
Thank you.
Okay. Over to you, Jenny.
Okay, 602-666-6027 is the number to call. Again, *5 to raise your hand. We do have other callers who have their hands up, and I'm going to get you in just one second. I want to follow up with the contribution also from Dr. Princetta and our good friend Margaret in Canada about this issue with Joanne in Florida on the TSH testing. What Dr. P said, Carolyn, you said, I'd like Dr. P's feedback was, he said, I do a complete thyroid panel including the antibodies as well as reverse T3-4 transcriptase. Get the results, use the ReMag, ReMite, retest, and you will see great improvement, including total reconciliation. So another great experience with Dr. P. And then also Margaret says, I was able to go off ERFA, natural thyroid, after 8 weeks on ReMag and ReMite. I gradually weaned off the ERFA after 4 weeks. So she started at 4, was all the way off at 8. I was also doing the yeast detox, and I have never looked back. I usually have more energy at 74 than I had 30 years ago. I'm so thankful. Oh, Margaret. We love Margaret so much. So there's some feedback again for our good friend Joanne down in Florida. So you've got some good information there. All righty.
Okay, one thing, hang on, Ginny. I looked up PSA test and inflammation. Many other conditions, such as an enlarged or inflamed prostate, can also increase PSA levels. So it's my I agree with myself what I said to Lori. When you get the tests escalating like that over such a short time, I wouldn't think of it as a prostate cancer, but I would think of it as an inflamed, infected prostate. And I've reinforced the yeast overgrowth possibility.
Very good. Excellent. Of course. Wonderful. Fantastic. All right. Let's press on with some of our callers. Let's go to area code 248, the great state of Michigan. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Tyra Woodson.
I missed the first. What's your first name?
Tyra.
Tyra?
No, Kyra. Kyra.
Kyra. Okay, Kyra. What's your question?
Well, I about 15 years ago, had my thyroid removed. So I know that I don't qualify for all the little things I'm hearing when people get off their medication, but I've also recently been diagnosed with diabetes and atrial fibrillation flutters. And high blood pressure too. So I know that I joined Weight Watchers because I wanted to get all this excess weight off, because I went to a integrative person and he was saying that getting all that weight off would help a lot. But my major concern was with the atrial fibrillation.
Yeah, atrial fibrillation, yeah.
Yeah, because that's the shortness of breath. I'm a person that loves to walk, and when you're trying to walk, you're so tired you can't get from this spot, and I'm not used to that. That's just you know. And so I'm believing, but someone told me about your magnesium, and I ordered so far the lotion. I hadn't gotten to the other ones, but I wanted to order those as well. So I was just wondering, how would that help with the atrial fibrillation, and does the medication that I'm taking with the thyroid has any impact on the heart beating out of the rhythm? And I know I've had problems with magnesium and potassium that were very, very low. And once they IV in me, it came back. But this time it didn't work for me.
Okay, Kyra, how old are you?
I'm 50.
Oh, okay. You're a young thing. My gosh, you shouldn't have all these symptoms. But what will happen is, as you listen to more of the radio shows, you go to our website, drcarolyndeanlive.com. There's 11 free books there now where you can download the atrial fibrillation book. You could look at the weight loss book. That would be good too. What happens with diabetes and high blood pressure and atrial fibrillation, they're all related to magnesium deficiency. One of the signs of diabetes is low magnesium. The heart rhythm requires magnesium in order to beat properly. And high blood pressure, the tension on the smooth muscles in the arteries will cause a tension in your blood and elevate your blood pressure. So they're all related. And the problem is, and you'll read about this, you may already have heard, but you sound like a newbie, but the problem in medicine is they don't study nutrients. And in day-to-day practice, they don't measure magnesium. So doctors are never aware that magnesium is deficient in a person. But, they'll have insomnia and headaches and tension, and then the blood pressure will come, and then the diabetes will come, and then the AFib will come. It's like the heart may be protected more than other parts of the body. And then with the weight, what I have in the book I forget what the weight loss book is. Maybe Ginny can help. But with weight loss, we talk about going on a ketogenic diet, because the whole thing about diabetes and weight is that you can't burn off fat if you're eating carbs. That's the bottom line.
Okay.
So as long as you're eating carbs, the body just gets lazy and just metabolizes the carbs and craves more carbs, and you feed it more carbs. Even if you're eating less and less and less, if there's still a fair amount of carbs in there, you're going to keep burning carbs. But when you stop eating carbs, you'll burn fat. So you eat more fatty foods, more fat and protein foods, and that puts you in the fat burning, and you start to lose weight. So you'll be happy to read that book, because that'll answer a lot of questions.
So you have that on your website, the ketogenic? I've heard about
Correct.
Oh, okay, because there's so many of those there, too. I'm glad I'm hearing this, because I went through a little depression with all of this, especially
sure.
atrial fib, it's like, and I know I can get off because the blood pressure had been coming down much better, and she took me off of one of the diabetes medication, because the A1C went down a big time, as well as the glucose, because I don't want that stuff. But know, the thing that scared me was atrial fib. That's the part that
But see, what you'll read when you look at this, the atrial fibrillation book, is that it's not necessarily that you have a heart condition, but you have a magnesium deficiency condition. And that's what you'll learn. The name of the book is Atrial Fibrillation, Remineralize Your Heart. There's so many books, free books here, that you have to look on the second page for that book. But just get what I'm saying here, Kyra.
Okay.
It's not necessarily that you have a heart problem, but you just have a problem with magnesium. Now, I know what you're saying, because that's how I started with my magnesium deficiency, is my heart going into palpitations and arrhythmias. So I know how that feels. And I know that it can make a person anxious and depressed. So you'll read that book, and then the other book about weight is Reset Your Ideal Weight.
Okay.
And the other book, there's one of our products is it's like a meal replacement with protein, fat, and very low carbs. It's called Restructure. And the title of the book is Restructure, a complement formula to reset your body. So there you have, enough information for you to just dive into. Know that the worst is over, and you've got some answers.
Well, you're the first one that said that, because when I went to the doctor, my regular doctor, and she sent me to a cardiologist, they were horrible. They kept saying there's nothing you can do about it. You're just going to have to live with this, and you'll have to take this beta blocker. And now they have me on the blood thinners, and that's so scary because I was reading up on that, and I'm like, I don't want to be on a blood thinner, and I'm just, so I just want to see if there is some other kind of healthier way to get through this.
Right, and you did ask me at the beginning, Kyra, about taking our products with your drugs, and it's perfectly fine. Do not get off your drugs until your doctor takes you off them. You can take our minerals, the ReMag and the ReMite, and you'll read about them in each of the books. I go over them in detail. There's about 4 or 5 products that would be good to take, but you can start with the ReMag and the ReMite. Those are the building blocks of the body that we're really not getting from our diet anymore.
Okay, so it's ReMag and ReMite. I do have the lotion. Is that any good? The lotion?
Oh, yeah. It is. You get the absorption through the skin, but in order to really heal your magnesium deficiency, it's going to be important to take the ReMag liquid by mouth.
Okay, ReMag. Now, once I just take this, do I still have to take a multivitamin, vitamin C?
Yeah, I've got that all written out in, if you can make a note, Kyra, it's a blog. Well, it's in some of the books, probably in the ReMag book, but it's also a blog called Dr. Dean's Supplement Recommendations. And, come to find out when you're on the minerals, and we have something called Realign, which is all the B vitamins, and the Bs are important for the nervous system and for detoxing. So that takes care of a lot of them. But you'll read about it in Dr. Dean's Supplement Recommendations, how I'm determined to get people off a lot of medications and supplements. People are on too many supplements these days.
Oh, yes. I appreciate this. Thank you. And all I need to do is to get on your Dr. Carolyn Dean Live.com.
That's right. And under books, it can be overwhelming, but just know that all the information is there. And then when you have questions, Kyra, you can email into support@rnareset.com, and that'll be in the books, too, to be able to ask any questions at any time, okay?
Oh, I appreciate this, and you have a lovely holiday. Thank you very much.
Oh, same to you, sweetheart. Thank you. Bye-bye.
Bye-bye.
Okay, excellent. Wonderful call. Gosh, that's wonderful. New people discover us all the time, Carolyn. Isn't it exciting?
It is exciting, and it gives us a chance to reinforce, how to do it and remind people that it's pretty straightforward. I used to say it's pretty simple, and people don't like saying, well, it's not that simple. You got to do it. But it is so straightforward, and it works, and you can make it simple. I mean, the way the liquids are, the minerals, I just pour all of them together, and I'm drinking them all the time. It's so simple.
Yeah, it really is. It is simple. And plus, you reach a certain level and you have a certain amount of success, and then something else comes along and we go back and we tweak things. So let's go to the great state of Ohio and talk to our new good friend at area code 513. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Hi, Jenny. Hi, Dr. Dean. My name's Sue. Thanks so much for having us tonight, and just always providing this service. It's so awesome that we get to talk to you like this. It's a great service. Thank you. Yeah, so I have a question. I had some recent lab work done, and I have a question on two things. One is I had this very low HNK CD57 panel. It was like a 28 or 30, somewhere around there. What does that mean? Do you know?
Okay, I missed the name of the test, Sue. Say it again.
It was a HNK. It came back a low HNK, a CD57 panel. Do you know what that is?
Nope.
Okay.
But I'm looking it up.
Look it up. While you're looking, I have another question. So I also was tested for Epstein-Barr, and how do you – I've had two different interpretations now, and each contradict the other, whether it's active or not. Which do you look at to see whether or not it's active? Is it the EBV-IgM? Is it the EAD-IgG? Is it the VCA-IgG or the EBNA-IgG? Which one of those tells you if it's active now or that you just had it at some point?
Well, I'm looking that up too. The other one, the CD, it looks like that's a Lyme test, correct?
Yeah, okay, right. And it was very low. They use it for Lyme. They don't always use it for Lyme, but they do use it for Lyme. They also use it for, I think, maybe mold testing. But they say it's not that definitive for Lyme. That there are other tests out there now and other labs that do it. But I didn't know what that meant to have a low 10K.
Well, if it's, I mean, I do not know the test, Sue, but one would think if it's about an infection, and if it's low, that sounds like a good thing.
Okay.
Right?
Okay. Well, it didn't. I don't know. I don't know. It seemed like when it was low,
let's backtrack here. Let's backtrack. Why are you getting these infectious disease tests?
Well, because I was diagnosed with fibromyalgia years ago, but then everything I've kind of done up until this past year has not really helped me, and so they started testing for some other things to see if anything else viral might be going on, or the Lyme. They had not, we had not tested for Lyme in the past, and so they decided to do that. So I think that was one of the tests they ran, and it came back low, but the interpretation was that low was not a good thing.
Right. Okay, well,
anyway.
This is, it's a good example of what I was bringing up at the first of the show. I don't know if you heard the first half hour where I said...
Sorry.
Yeah, doctors will just test and test and test, and they may be going down the whole wrong pathway. In my world, fibromyalgia is 50% magnesium deficiency and 50% yeast overgrowth. And in among the magnesium deficiency, too, can be other mineral deficiencies, because people with fibromyalgia, there's a tendency over time for the thyroid to kind of get weakened, the adrenals kind of drag, there may be early menopause. It's all part of what I call total body meltdown. So before going into all kinds of testing, which will be equivocal, all the Lyme testing is equivocal. Everybody has Epstein-Barr. 90% of the population has Epstein-Barr, and so that's nothing new.
But is it?
Well, if it's active, right? Sue, if it's active, you've got a fever and you're in bed. Epstein-Barr is like mono. It's like a bad virus. You're active, then you're sick. And every test, when I was doing AIDS and chronic fatigue research in New York in the early 90s, everybody we tested who came to us and they were already ill, they had everything. So what are we going to do? Take every parasite, every virus, every bacteria, every yeast, and treat them with all kinds of different things? No. What you do is you boost the immune system. And the biggest offender in people's health in terms of infection is yeast overgrowth, because it's normal to the body. I call it a stealth organism. The body actually kind of ignores it, and it really does overgrow. It has 178 different toxins that affect the body from head to foot. So it's the one to focus on, and the minerals, especially in the form that we have them, the stabilized ionic minerals and the ReMag and the ReMite, they support the structure and function of the whole body, and people start getting better. So that's my rant on fibromyalgia, and I go over that in, you heard me talking about the free books. The last two books on the list of 11 are about ReMag and ReMite. I think it's in the ReMite book, I talk about fibromyalgia and chronic fatigue and thyroid and all those things. So what you're getting done with the lab work is like, oh, well, let's see if it's Lyme, let's see if it's Epstein-Barr, and then someone will say, well, and they probably already have, let's look at your thyroid, oh, we better check your adrenals, oh, let's look at this, and it's just, it's overwhelming, the amount of testing they can do. And then, the microbiome now, everybody's got microbiome problems.
Yeah.
Well, what do they do with that? They're focusing on bacteria, and they're focusing on lactobacillus and bifidus. They don't look at yeast overgrowth. They're giving people antibiotics to kill everything off, and then giving lacto and bisto. It's just all so piecemeal and so reductionist. I'm looking at the big picture. Get your minerals in place, get rid of the yeast, and we'll see what's left.
Well, what if I haven't tested positive for any yeast, blood or stool or any of it?
Well, that's the problem with yeast tests, is they're not effective. I did yeast antibody testing in my own lab up in Toronto for years, and I compared it with the questionnaire, and the questionnaire was much more helpful. And the thing with getting into the Lyme bucket is they'll start wanting you to take antibiotics, which will cause yeast overgrowth.
Yeah, I refused. I said no.
Right.
I'm not doing antibiotics. Right. I know that. I read your book.
Right.
I'm not doing antibiotics.
Right. Well, and look at the yeast book, Reset the Yeast Connection, and see what makes sense there. Because what happens with healthy people who are really trying to work on their health, when you get a fibromyalgia diagnosis, you take care of things. And a lot of people that approach us, they have kind of partially treated their yeast so that it's quiescent. It's not really that obvious, but it's still there. All you have to do is take a couple days of antibiotic and boom, it's back. Or you go on alcohol or sugar binge. Not saying that you're going to do that, Sue, but Christmas is coming up. So
I haven't had a sweet in 3 years.
I know.
No, I haven't.
Starving.
I was on paleo for 2 solid years, and so no, I haven't had sweets in a long time. So I haven't had, I don't feel like I have yeast because I've been so good about my diet. But
well, that's what I'm saying. Yeah, that's just exactly what I'm saying. People have their yeast, quote, under control, but it can be like a subclinical situation that's always sort of a low grade. When I started on my Pico Silver, that boosts the immune system and works on yeast and everything, my sinus, kind of drippy sinuses cleared up, my slightly coated tongue got better. And I just think that these underlying things that we can't really test for are a problem, because I've been working with this since the 80s.
Okay. Well, it all makes sense. I mean, I do use your ReMag lotion. I had started the ReMag and the RNI and the whole reset last fall, and then I started getting, like these, not blisters, but sores on my fingers and toes, like these red sores. I forget what you call them, and so I didn't know if that was something trying to come out or detox or what. So I don't know if you've ever had that feedback, and maybe it was yeast coming out at the time.
Right. Any sort of rash that kind of hard to diagnose rash that comes up when you're doing our protocol, we do focus on yeast right away. It's like it's under the surface and it comes out. Were they the sores, were they itchy, irritated, liquid in them, or pus in them?
They weren't liquid, and they're what they call a perinosis. Just the red, like red bumps, if you're familiar with perinosis.
No, I'm not.
Yeah, well, I'm sure as a GP, you probably, you may have probably seen them or a PCP come across them at some point. But, it just, they're not full of anything. They start out as this really little dot, and then they get bigger. And it was like I thought, well, is something trying to detox out of my body? And I did finally get off of it, and it went away, but I just didn't know, what to do about it. So.
Right. What's the spelling of that, Sue?
PERNIOSIS, and there are pictures all over the place of them, and they also call them chilblains, CHIBLAINS.
Yeah, right. Okay, let's look at this. Paranosis is an inflammatory disorder triggered by prolonged exposure to cold and damp, form of inflammation of the small blood vessels, vasculitis, painful, itchy, tender skin lesions, rare form of vasculitis.
That's what they say, yeah.
Right,
that's what they say. No, that's what. If you see the pictures, that's exactly what they look like. So that's
right.
That's exactly.
Well,
what
you know, when I hear something called an inflammation, then I do think. I think of a subclinical infection. I think of magnesium deficiency. So those are the two things I'm talking about. Is a subclinical yeast and magnesium and mineral deficiency. So grab some of my books and read and see what you think.
Okay.
And, because like you say, you worked with our complement formulas last year, and you had some reaction, and I don't know if you call customer service, but maybe we could have talked to you back then. But now you're on this highway to try to discover what's going on.
I know.
And
Yes, I know, and I don't like it at all. It's just kind of like, oh my gosh, because somebody's always going to find something wrong with you. Always something that's going to border on low or too high or whatever, and people will run with that. And and I think you're right that it doesn't have to be so complicated. That it really is simple.
Right. Yeah. So I want you this time to keep in touch with us. Start the process, phone up, and call customer service if they don't answer, or if they're not able to give you the answers you want, they'll pass your question on to me. I'm always here.
Okay.
We want to help you with this because I really think it's the minerals and yeast overgrowth. Okay?
I hope that's true, yes, and I really appreciate all your time tonight. Thanks so much.
Oh, thank you, Sue. Great call. Appreciate you.
Have a great holiday. Thanks.
All right. Same to you. Bye-bye.
Welcome. Excellent. Okay. My gosh, the phones are just ringing off the hook. Let's go to area code 267, Philadelphia. Hello. You're on the line with Dr. Dean.
Hey, family. It's Kendall. How are y'all?
Oh, hi, Kendall. Oh,
hey.
Should I ask how are you, or are you going to tell me?
I'm gonna tell you. So, I know I wrote you because I was sick. Like Dr. Dean, I felt like I was leaving out of here, and Jenny gave me such good customer service. Long story short, I had blood work done, and I was waiting for it to come back. But in the meantime, I was just really, really, really scared. But she talked me through it, and when it came back, it said that my anemia was 7.5. My hemoglobin was 7.5, but it said that my platelet level was high, so I was a little concerned about that. And I wanted to get your opinion on, what do you think that means?
Well, the thing of it is, I'm not 100% on this, but when you have a low, it's like all relative. If your platelets haven't been affected by the anemia, they'll look high compared to your hemoglobin, which is looking low.
Okay, so my platelet level was 546, but my hemoglobin was 75.
Yeah, right. And what does the doctor say about that?
I'm waiting to get an appointment with him to go over it, but when he called, I had to literally that's why I said you don't know how much I appreciate y'all, because these doctors do not care. And when I had to call him and harass him just to even get the result. And he was like, you know, pretty much like very cold. He was like, it's nothing. He even said, like, my hemoglobin, like, that shouldn't make me feel like I'm dying. Like, he was like, you shouldn't feel anything. But then I heard another person say, like, you know, they were about to be asked to have a blood transfusion, and theirs was at 6. So if mine was at 7, I'm sure I should be feeling, you know, kind of bad, which I was. I was feeling. It was like every time I changed the position, Jenny will tell you, I kept, like, writing her, like, every time I changed position, my heart speeds up.
Oh, yes. Yeah. Sure. Okay, a couple questions, though. Are you're losing blood with your periods? Is that what happens?
My blood is very thin. So, I do, if you ask me, I think I lose more blood than the average bear with my period, yes.
Yeah. And is that the reason for your anemia?
Yeah, because I think over time, because I haven't replenished any of the iron, I think that over time it just was like, you know, draining me.
So are you on a good iron now, like a liquid iron?
Yeah,
Did we tell you to? Yeah.
Jenny referred me to the liquid iron, but how do y'all take it? Y'all put it in water? Because the one when I got it, it says to take it with 6 to 8 ounces of water, but because I was waiting for the one that I ordered to come, I had got some iron from another store, and that one you don't have to take with water, you just down it. So
you don't necessarily have to take it with water. I would take it alone, though. I don't know how it would mix up with the other minerals, but you got to get your iron up. Now, about the platelets, Kendall, the normal range is 150,000 to 450,000. What did you say yours were?
546.
546. So it's probably elevated it is elevated according to these levels, but it's probably in relation to the hemoglobin anemia. It's like the platelets are trying to make up for what you don't have in the hemoglobin. So that's what I'm thinking. And then we're getting real medical here, but I understand what you're saying, because when the hemoglobin is low, the body needs all that oxygen, so it makes your heart speed up to get more oxygen to your brain, and then you've had the AFib problem, so that's going to, freak you out. So, you're going through a bad time. I'm sorry about that.
It was so scary. But I'm going to tell you something about magnesium, and I'll tell anybody that'll listen. That is what got me through those 2 long weeks, because it was 2 long, excruciating weeks. You already know how scary I am when it comes to feeling those type of things. And I would just take, Jenny will tell you, I would take the magnesium, I would take ReMag, and I would rub it on my chest. When I got to the point where I couldn't take it anymore, and I would also drink it. I was drinking my salt water, and I was just praying and just trying to be positive, using essential oils. But if I wouldn't have had that magnesium, I don't believe I would still be here, because I didn't have any idea that my iron was that low, and my heart was literally pounding out of my chest. That magnesium is a lifesaver. It really is. It really, really is. So
good. Now, are they, I know you were wondering about your uterus and all. Have you made any decision there?
Well, what I'm going to try to do is a few more little different, like homeopathic natural things that I've been working on. And they have been working, but I think that what happened was because it was going for so long, and I was bleeding like that for so long without having anything help it, that I was just really behind. I didn't have, like, how you use the word stores. I didn't have any stores of iron at all, or whatever. Right. So I think now, if it doesn't get any better, of course, at this point, I don't have a choice. But so far, so good. I've been trying a different therapy, and it has been working. But
now, Kendall, did you hear our homeopathic show last week?
No, I missed it.
Yeah, we did a show on homeopathy, and we have a homeopathic kit. But the thing is, the homeopath who made the kit, Mary Aspinwall. She does telephone consultations. So that might be something very appropriate for you to help find the right remedies, the right homeopathic remedies to settle down your... Yeah.
Let me ask one more question real quick. Would I aggravate my anemia by eating ice? Does eating ice make anemia worse?
I think with anemia, anemia can cause people to crave ice, but I don't think it makes it worse, but that's a real sign of anemia from what I remember back in the day.
Okay.
Wow. Okay. Yeah, you've got it bad, girl.
Yeah, you do, because I have a friend who was just telling me that she was craving chocolate chips and ice for months and didn't know it was a sign of having anemia. So, yeah, but it doesn't make it worse. It's just water.
Yeah.
Okay.
Wow. Okay, so Ginny will send you the thing about Mary. You can check out her Facebook page because, to choose the right remedies for something serious, it is important to get a consultation. Okay?
Yeah. Thank you so much, guys.
Okay, sweetheart. Big hug.
Yes, indeed. I'll be good.
Bye, honey. Glad you called in. Bye.
Yeah. Bye-bye.
Okay, Carolyn, pressing on. The Dr. Dean train keeps rolling. Area code 310, the great state of California. You're on the line with Dr. Dean. If you could give us your name and then state your question or comment.
Is it me?
Yes.
Oh, my gosh. I'm so glad to be on the air. Oh, I just want to thank you, Dr. Dean and Ginny. First of all, I just have to tell you, you are the most beautiful people. So generous, and my heart's so full of gratitude for you. My name's Cindy, and
hi, Cindy.
Hi, and I'm fairly new to your formulas, and I first want to say that I don't buy stuff off the internet in terms of supplements and stuff. I've never, even Dr. McCullough's products, I just wouldn't buy them in the store. And so I didn't come to this with the expectation that I would be a customer. And I'm saying that because I have a 10-year-old diagnosis of autoimmune condition, collagen vascular disease is the diagnosis, and it presents as lupus and Sjogren's syndrome. And when I first was diagnosed, well, I will first say that I had just come off courses for 2 years of antibiotics in a treatment for rosacea. And I have a long history of antibiotics because I had acne as a child or a young adult, and I also took Accutane. But so there's a fair amount of, I would say, organ stress or damage, and not to mention the destruction of my gut and yeast overgrowth. And so when it came to being treated by Western medicine, and what they had to offer were the anti-malarial drugs and steroids, and I'm so grateful because at that point, my body had the wisdom to just scream at me, no, it just can't, that's not a possibility. I had no idea where I was going to turn or what I was going to do, where I was going to turn and, where I was going to get help, but I knew I couldn't go that route. So it began a long journey of, trying to find alternative routes. And I live in Southern California, so, there's a plethora of possibilities. But I have to tell you, sometimes the more more possibilities there are, the more difficult it is to find your way in the jungle. And anyway, I've used all different kinds of therapies. I've used all different kinds of modalities, some to real good results, and but nothing to cure, nothing to give me the hope that, I mean, maybe I would have some hope or some promise for a while that, well, maybe things could get better, and I could live a normal life. And I've been disabled by this condition, and also I've had severe constipation since ever I can remember, and one time even going a month without hardly going at all. Yes. But because I'm so adverse to going to doctors, I just never ever dealt with it. I'm really glad for that now. So anyway, fast forward to very recently, I was having and I will say that I've been able to manage my disease. Like I can live a somewhat functioning life, but I'm not a fully functioning individual and haven't been for a long time. And so I was having a conversation with a friend from my yoga practice, and I this last 3 years, what had started to happen is that I slept really well my whole life, and I started to get insomnia. And it became so severe that I went, like I really wasn't sleeping at all. And that would go on, say, for like a week or so, and then maybe whatever I was trying to do to treat it, or whoever was helping me at that point, the acupuncturist, Chinese doctor, or whatever, I'd get a little bit of relief, but not like full on, and it wouldn't stick. And then I was having panic attacks because of that, and because I couldn't sleep. I was freaked out because I couldn't sleep. And anyway, this last couple of years have been really a quiet desperation around all that, and serious depression. And what I was starting to feel that I maybe had Hashimoto's also, but the last thing I want is another diagnosis and other doctors involved, and their opinions and the whole thing. And one of the things I want to say to you more than anything is that your ability to see the whole picture and to piece it all together I have never, ever come across this in this whole search ever. And I think a lot of times for the listeners that, and several of the women calling in with maybe new situations or new diagnosis or whatever tonight, and it's really hard to trust that one authority could, and someone who's so generous with information and that also sells products really could have your best interests at heart, and could really, and really you can trust everything. And I proceeded with caution. I'm just going to say that. And at first what I was doing is I was treating with my own magnesium, and that's how I found you, because I started to see, no one ever told me, we'll take all different kinds, and so for some way I started doing that just because I needed some to go to the bathroom, but that wasn't affecting anything. And so somewhere along the line I started doing that, and then I searched and found you. And when I found you, then I started listening to you first, and I started, just reading your blog posts. And what I saw in your blog posts was who you are as a doctor. And the one I saw that really was so remarkable for me was the one about the PTSD around doctors and medical treatments and such. And that was so profound, because it was I thought it was a crazy person, because that's how I feel about it. And you gave voice to that. And what I want to say to anybody who's new to listening or new to trying your products or whatever is just, start with the ReMag. That was what I did. I just started with the ReMag, and was using my other magnesiums, and I started with that, and I just dove into, you became like, okay, this is my doctor now. I'm just going to, trust what this woman says, her research, and, I just threw myself into your care, like with my own care. And you have not led me astray, and every single week I listen, and I have more immense gratitude, and and respect for you. And it's hard to believe that a person like this exists, really, in that profession. And I want to say now that I'm basically on the whole reset program and just had been introducing them slowly. Finally, I'm actually adding my RNA drops. And at first I was like, what would I ever need those for? And oh my God, it's just, I can't even believe, I'm so empowered now because I'm able to discard this and discard that, and really now the most important thing, and you promised us this, I've heard it so many times from you, is that if we get the building blocks, we'll start to be able to hear, our body will be able to tell, we'll know, and we can trust that knowing, and it's true, it's really true, it's absolutely true, and so thank you, and yeah, and everybody else, the information, there isn't a thing that she doesn't cover. So just go to her site and use the search engine, and the information is there in the archives, and just trust yourself and trust the information, and start introducing the products. They will rebuild you. I would never think that I would be able to whittle it down to just this in terms of my care, and to say, you know what, this is my path to health, and I am going to be healthy. And mentally and emotionally, I've been able to discard, all the other possibilities of those kind of treatments, because of course I'm going to have depression. Of course I'm going to feel desperate if I'm not sleeping because I'm so deficient of magnesium. And those things are changed now, and the neurosis is starting to change finally. And so thank you for being right. Thank you for, being a rebel and a renegade, and thank you for getting all this, whatever you had to go through to not practice Western medicine the way that you were. Thank you for that, because you wouldn't be here today maybe doing what you're doing for us in this way. And so I can't say thanks enough.
Oh, that's beautiful. It's just beautiful. It's like you scripted the most perfect testimonial of somebody who, as you say, skeptical, but stepped in the water and then got swept up into just this wonderfulness. It's awesome. Thank you so much.
My pleasure. Thank you. Thank you, Ginny.
Now tell me something. Did you ever use the total biology affirmation, the small property affirmation?
I did. I have to say, when I saw that, I just choked, I choked from the top of my throat down, to my perineum. But I felt it, and it's inside of me, but I have a really hard time just doing affirmations for, you know what I'm saying, like the thing of the rote, the 10 times, because then it doesn't necessarily feel so alive in that moment or whatever. And I also, it's the thing of making it a job, but I will say, I've recently come back to my soul care, because I have the promise, I couldn't even go to that part of me. And you say this too, and I want to thank you for this, because I was trying to work with myself spiritually, mentally, and emotionally at a time when I didn't have the physical energy. And you were the first one that I heard say this. That's why the acupuncture, I worked with one of the top homeopaths in the country, and he's a classical homeopath, and I got my remedy my what is it called when constitutional remedy, but it only went so far. I was still constipated. I still had yeast overgrowth. I still had dysbiosis. So it wasn't going to and he thought I was cured of lupus, and I'm like, I'm not. I'll let him believe I'm cured, but I wasn't. And now I see it was really. When I first before I was taking the ReMag, and I was playing with magnesiums in high dosage, and I went over 1,200 most of the time. I was just taking magnesium and not worrying about how much. And that's when I even saw beyond that I would go to the bathroom, that I would have some relief of the kind of fibromyalgia symptoms, or the anxiety. I started to feel calmer, and I never had, like, all day long, I would have I was releasing adrenaline all day long, and especially when the sleeplessness started, and then once I started getting the ReMag into my body, it was like hope started to build. And then there was, and the main thing I want to say to people is that I never knew magnesium would give you energy, or that about the detoxification. And both of those things, I could feel them happening to me once I was starting to get a little bit, of actually usable magnesium, because I was mostly taking oxides, just to go to the bathroom. And once that started to happen and my energy started to come up, and yet it wasn't stimulated, I was starting to sleep and relax, then I started to have hope, and I could have, some normal emotional and mental capacity and better decision making. And now I'm being able to do, my soul and spiritual care, and so. I'm not sure that the total biology is even going to be necessary. And you say that, it's like this thing of, like, one of the things that happens in alternative medicine, and you call it out on this, is that, all this, they work allopathically. I'm sorry, but they do. That has been my experience. They work according to
Hold on. We've got only about 30 seconds. I want to thank you for your call. Carolyn, closing comments, and then we've got to wrap up the show. I'm so sorry.
I'm so sorry.
Oh, you're awesome. Cindy, we really appreciate what you're saying. You helped so many people with your reporting and what you've gone through. Thank you so much.
Thank you.
Yep. Many, many blessings to you. You touched many people through your call. Thank you so much. And call back again. We got to wrap up the show. Great show, Carolyn.
Thank you, Ginny. Thank you, Bob.
Thank you, Ginny.
Thank you, Bill. And thank you, listeners.
You've been listening to Live with Dr. Carolyn Dean here on AchieveRadio.com. Till next time, so long, and thanks for all the fish.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/Achieve.